Then when someone is already in active treatment like chemo or radiation, how does Chinese medicine fit in? Does it complement, conflict, or stand apart?
I think it's mostly complement, and it depends on the setting that it is, the clinical setting. In China, let's just use an example in China, where the oncologists actually, the Western oncologists work with the Chinese medicine practitioners. They make sure that each team knows what the other is doing. So the Chinese medicine practitioners will be aware of what the oncologists are doing, their radiation schedule, the chemotherapy schedules, and then the Chinese medicine practitioners will help use formulas and herbs to help alleviate some of the symptoms associated with those type of therapy. So that's a plus. So they complement. Now let's talk about conflict. Can herbs conflict with Western medicine? The Western medicine aspect of it?
I think that's one of the biggest
Yes.
why people are afraid.
The answer to that is yes, but that's a qualify yes. It's oftentimes more overblown. And because in the West, where the oncologists are not working with the Chinese medicine practitioners, and the oncologists are not familiar with Chinese medicine, you have that problem because there's a lot of potential interactions that may not come to bear, or maybe that it could be easily avoided if the timing of each side can be adjusted. For example, you would use the Chinese medicine therapy after a certain period. Once the Western medicine clears the system, for example, that can be done. And that is not really that hard because they do it in China all the time, right? They have the oncologist would speak with the Chinese medicine practitioner. They may get a pharmacist involved, and they'll figure it out exactly when, right? Each should be done.
Yes.
It's a team effort, and we kind of lack that here in the U.S. So that's where the conflicts come in, right? You have a lot of oncologists in the U.S. are not trained in Western medicine and Chinese medicine. And then you may have the Chinese medicine not necessarily trained in Western medicine, so there's a lot of misunderstanding and conflicts. But it need not to be.